Not enough evidence for treatment, COVID and vitamin D. But everyone is still advised to take a daily supplement this winter to keep bones and muscles healthy. Health officials carried out a rapid review of the evidence on links between vitamin D and COVID-19, after a small number of studies had suggested it might play a role in the body's immune response to respiratory viruses. Health experts who studied the evidence said more high-quality randomized controlled trials were needed before they could come to any conclusions. Professor Adrian Martineau, clinical professor of respiratory infection and immunity at Queen Mary University of London, said there was a chance the vitamin might reduce risk and/or severity of COVID-19, and clinical trials currently in progress would hopefully shed light on this question. Taking vitamin D is particularly important this winter because of the amount of time people have spent indoors isolating and shielding from coronavirus. Vitamin D can also be obtained from certain foods, such as oily fish and cereals, and supplements. Some people are at risk of not having enough vitamin D even in spring and summer, including people in these groups are advised to take a vitamin D supplement all year round. Dr. Alison Teedstone, Chief Nutritionist at Public Health England, said, "We advise that everyone, particularly the elderly, those who don't get outside and those with dark skin, takes a vitamin D supplement containing 10 micrograms, 400 IU, every day," she said. Trial to test if vitamin D protects against COVID. Warnings are in place in 14 states, with up to 2 feet of snow forecast in Pennsylvania and New York. Melbourne Towers lockdown breached human rights. Not enough evidence vitamin D prevents COVID. Korean Lantern Festival gets UNESCO honors. China's drinkers develop taste for homegrown wines. BBC Culture, inside the homes of legendary artists. COVID and vitamin D, not enough evidence for treatment. 3. COVID, Melbourne Towers lockdown breached human rights. 6. Lockerbie bombing, new suspect soon to be charged, US media. 10. The BBC is not responsible for the content of external sites,